Okay guys, I'm just going to start by just a couple of safety messages, which is around the fire alarm. So we're not expecting a fire alarm this afternoon, and if the fire alarm does go off, you take a right and head down the stairs. There's also some toilets just there at the back on the right hand side. So I'd like to give you all a really warm welcome here to the Storey in Lancaster for our Digital Exemplar launch event. We're really hoping that over the next couple of hours you find the session not only interesting and enjoyable, but also informative, and we really want it to be a two-way experience, an interactive event really, which will allow us to get as much information from you as you get from us. Thank you very much as well to everyone who's here today. We appreciate that it's been taking 3 hours out of your really busy schedules is a big deal. And I'd also like to thank all of the networks and practices who have put themselves forward to be part of the Exemplar programme. So thanks very much. In terms of who I am, I'm a GP for the most part, just down the road here in Garstang. I work nearly full time, but I'm here in my capacity as a primary care clinical lead for digital health for the Lancashire and South Cumbria STP. In terms of my own background experience in digital innovation, that's really largely centred around my work as clinical lead for the Morecambe Bay Advice and Guidance System, which has now been in place for the last 4 years. That's more around the kind of primary-secondary care interface than looking at primary care. So I'm going to take some time and a few moments just to give you my take on what the Digital Exemplar programme is all about. However, first I thought it would be really useful to do a little bit of a who's who in the room. So first of all, could I ask all of the Exemplar team from Redmore to stand up if possible, please? So we've got Mark, Lisa, Paula, Mike and Richard. All about. Just give us all a wave so that we can all see who you are. We're really lucky to have Mark and his team on board with this project. They're going to be working in the capacity of overseeing and managing the whole project, but also working really closely with all the Exemplar networks and practices on the ground. They bring with them a great variety of skills and experience, and are really perfect for the role. I thought it'd be useful just to do a bit of a straw poll today to see who we've got in the room. So can I ask all clinicians if they could raise their hands? Brilliant, it's good to have a number of clinicians here. What I'd say, guys, is that it's your role in the Exemplar programme. I can't emphasise how important it is as key influencers at your practice level in terms of change of the culture. Can I ask now for people who are either working administratively or in a management role to stand up for me, please? Just raise your hand. Brilliant. Okay, so we've got an awful lot of you. Again, your role is really, really important in this. Not only in terms of inspiring, but also supporting your colleagues at ground level throughout the process. So, the only other thing is to get an idea of geography. So could I ask anyone from West Lancs to raise their hand? Okay, we thought that might be the case because we believe there's another big event going on in West Lancs. How about East Lancs? Brilliant, thanks for coming on board. Fylde Coast, so Fylde and Wyre. Brilliant. Morecambe Bay. Yeah. And last of all, Central Lancs. That's brilliant. Okay. So what's my take on the Exemplar programme? Well, first and foremost, for me, it is about providing a package of support to practices and networks to facilitate innovation on the front line, to support practices and networks in trying ways of being digitally smarter, essentially. Now, when we think about sort of innovation, at GP practice level, it's not a new concept, is it? I mean, it's something that we're probably already experts in. Sort of as running small businesses over the last couple of decades with all the changes in the NHS, we've become experts in innovating from the front line already. What I would say about innovation in this context is that we're not just talking about innovation for improving our patients' experience. Yes, that is all really important, but equally as important in my mind is about innovating to improve practice resilience. You know, we live in a really challenging time in primary care, and I believe that actually by using digital solutions in a smart way, we can improve our efficiencies, not only in terms of the way we interact with our patients, but also in terms of the processes within the practice or the network. Secondly, it's about being flexible, isn't it? What do I mean by that? Well, what I mean is listening to the practices involved. So we're not here to give a top-down approach dictating that you should or shouldn't do this, that or the other. What it's about for us is actually listening to practices. We're about acknowledging that each practice or network will actually have different ideas about what their priorities are to get out of the programme, and then adapting and supporting and tailoring that support accordingly. We're also about acknowledging that different practices and networks are actually at different stages of the journey along the road to digital maturity. So again, it's about tailoring the support we offer according to those needs. Furthermore, we acknowledge that practices and networks also may feel comfortable at going at a certain pace. So again, it's about adapting the support that we offer. Last of all, I think it's worth commenting that it's also about acknowledging the fantastic work that's already going on from our respective CCGs and the IT work streams, and working hard to complement that rather than conflict with it. Thirdly, it's about sharing. What do I mean about that? Well, it's really about instilling a culture within the programme whereby we're sharing the good ideas that we have, not just in terms of sharing between the exemplar practices, but also beyond that. So towards the end of the programme, what's worked well, what are our successes, how are we going to share those with the wider primary care community? We'll be spending a little bit of time in an hour or so in the tabletop groups looking at this issue about how we actually can facilitate sharing and networking between us throughout the programme. We'll also be taking some time to look at how we're going to evaluate our successes, how are we going to say what's worked well and how are we going to measure that. I'm just about to hand over to Mark, who's going to give you a bit of a run through about the plan for the day and introduce our first guest speaker. But I thought I'd just give a quick plug really in terms of making a start on how we start networking and sharing. So what we've done is we've set up a private closed Facebook group, which you can either take down the link here, but it's also in the invitation that you received yesterday. For people who don't like the idea of Facebook, we are looking at other strategies, maybe using WhatsApp or other media systems really in terms of finding ways that we can share. Also feel free to tweet if you like during the course of the afternoon, things that you find interesting. So without further ado, I'd like to hand over to Mark here.